Hi, I'm Dr. Prashant Chhajed. You're watching me on Sifi.com.
Steps towards the better management and control of asthma.
I think this is a very important and a crucial question. What are the steps towards the better management of asthma? The most important thing in asthma, I believe, is the diagnosis of asthma. I think whenever patients have typical symptoms, of course, in the acute setting, one has to treat them with the symptomatic therapy, but eventually a pulmonary function test needs to be performed so that a diagnosis of asthma can be established. A pulmonary function test, commonly known as the PFT, is a very simple test and typically takes 20 to 30 minutes to perform, and it is not complicated at all. The second issue is, exposing or, telling the diagnosis of asthma to the patient. Many patients don't want to listen or want to know, that they have asthma. And therefore, sometimes there's a compulsion to, use different terminology to convey the same disease to the patient, like allergic bronchitis or, some allergic, bronchospasm. The very most important thing is, if there is asthma, it has to be conveyed to the patient. Yes, it's asthma, and education has to be given to the patient that there will be only a good control of asthma, and a good control of asthma is possible. So there's no running away from facing the diagnosis. The third important issue is, whenever a patient has been diagnosed with asthma, patient is symptomatic, we offer them therapy, patient takes the therapy, patient becomes well, and then patient decides to stop the treatment often on their own. The important message I like to give across is, whenever we are treating asthma, there are two types of control we want. On one side, we want a patient control where a patient can lead a normal life. That means a patient can sleep well. Whenever the patient wakes up in the morning, he should be free of symptoms. He should be able to perform all the daily activities. The individual, if is sporting, should be able to perform sports, and there should be no loss of work or loss of school. So these are the goals of asthma from an individual perspective, from a quality of life point of view, and in terms of performing the daily activities. Once these are achieved, often patients will think, oh, I don't need to take the treatment, I'm fine, and then there's a risk that they may stop taking the treatment. The next most important thing is that not only symptomatic control is important, also the lung function test needs to be normal. So once you have a good symptomatic control and then you have a normal lung function test, that's the time when your doctor will reduce the doses of asthma, and whenever the doses of asthma treatment are being reduced, the patient will be monitored for symptoms as well as with the lung function to make sure that the reduction in the dose of medication is not causing symptoms or a fall in lung function. And if this can be maintained, it's very possible in a lot of patients, we are able to get them off the regular medication and then keep them only on SOS medication, that is as required medication. Having said that, it's possible that the asthma can come back in terms of whenever the patient is exposed to any trigger or any factor which has led to the exacerbation of asthma, and therefore the education is very important that we can get a good control of asthma, but cure of asthma is not the thing to chase for. And lastly is the adherence to treatment. We have several patients who have still some I would say reservations to the use of inhaler therapy. It's very important that the inhaler therapy be understood as the gold standard treatment for patients with asthma. Whenever I explain to my patients about inhaler therapy, I tell them that yes, and actually it's a fact that the inhaler therapy works like our eye drops which we put for an eye problem, like the nasal drops we put for a nose problem, or a ear drops which we put for a ear problem. Similarly, for the lung problems, we have to use nasal sprays because they go and act locally, and of course the amount of dosage required to treat is far less than we would have given the same treatment with the medication. So this understanding is very important, and also adherence to treatment is important. Often we see that patients in whom the asthma control is not optimal, often there is an issue of adherence to treatment. Now the adherence to treatment may be based on the patient factor, or also may be based on the type of devices which have been offered to the patient. So it's very important to discuss your device which your doctor has given to you, and if you are not comfortable with the device which is given to you, please discuss with the doctor and find out if there's a simpler device or a device which is much more better suited for your lifestyle and for your convenience.
Your takeaway message for our viewers on asthma.
So the take-home messages for you or for my viewers who have asthma are: A, that asthma is a controllable disease. B, you can have a good quality of life despite you have asthma, and most of the patients with asthma will be able to do all the things which individuals without asthma are able to do. C, it's very important to understand about your disease. If you have any questions about asthma, please feel free to talk to your doctor about the disease and understand the disease and get your questions sorted out. Fourth, if you have been prescribed any inhaler therapy by your doctor, it's important that you take the inhaler therapy as prescribed and you understand from your doctor which part of your therapy is the controller therapy and which part of the therapy is reliever therapy. Because the reliever therapy is the therapy which you will need to carry always with yourself in case you're exposed to any pollutant which causes an acute increase in symptoms.